Hello, everyone. This is Dr. Nelson from Central Florida. Uh, we are on the 4th of September, 2025, and we're going to be talking to Shawn and Janet Needham, and we're going to meet them in just a second. Let me click live on Instagram. Uh, Thank you for being here. Uh, where are you coming from, Shawn and Janet?
So we are actually in Moses Lake, Washington. It's Washington State. It's central/eastern Washington. So it's kind of odd to what some people don't understand, but they think of Washington, they think of Seattle, they think of the rain, and we actually live in the desert in Washington. So
Okay,
it's
so
yeah,
is that more eastern on the state?
yes.
Okay.
In fact, today, yesterday it was close to 100 degrees. Today it'll probably be close to 100 degrees. There's lots of forest fires going on right now, though.
All righty. So we have Roxanne here, Cheryl, Terry B, Eleni. Thank you for being here. And if you have any questions as we go in our conversation with Shawn and Janet, please put it in the chat with a QQQ. I apologize if I miss one. If it's something really important, put it again. Tell us where you're coming from, watching from, and so these folks I met in Seattle, Washington, when we had the meetup with Dr. Baker and the Healing Humanity crew, and Dr. Kiltz and I were also there. And I'm gonna let them tell you about themselves. Shawn and Janet, tell us about your story of healing, your low carb keto journey,
Yeah.
and
So,
what you do.
yeah. So I think probably one of the most important parts of this conversation, and one thing that Jan and I first get out to people is that we are both pharmacists. We are two pharmacists that don't believe in drugs to treat most long-term disease. We've practiced for over 30 years now. And I actually wrote a book called Sickened: How the Government Ruined Healthcare and How to Fix It. It was a #1 seller on Amazon. And basically it Janet writes the forward in the book. And I'll let her tell a little bit more of that story. But it was, as pharmacists, you know, 2 decades ago, we saw that our patients were never getting better. And all these diseases they had, whether it be diabetes, whether it be reflux, whether it be orthopedic surgeries when they have bad knees or whatever, um, they were all lifestyle created and mostly diet created. And so we've been on a journey over the last 2 decades to preach sleep, diet, and exercise, and that will get rid of most disease. So we do own a compounding pharmacy in Moses Lake called Moses Lake Professional Pharmacy, and we focus on talking about lifestyle and hormones. We do believe that hormones are a piece of the puzzle. We still preach diet, sleep, and exercise first, but hormones are a piece of that puzzle. So that's a quick journey on who we are. I will go in later about my health journey and how I overcame obesity, almost 15 years, over 15 years ago. Janet, tell your story.
Yeah, so this is something I think for Dr. Nelson, for yourself, you probably can see where we're coming from as pharmacists. That in our journey, I was so disappointed that people were not becoming healthier. They weren't healing, and that just didn't sit right. There was just a part of me as a pharmacist that really was struggling. So I left retail to Shawn and I opened our own pharmacy and thought we could do things differently, but we were still in that setting of, helping people fill prescriptions, and those prescriptions just turned into one after another. You've probably heard of the word polypharmacy. Well, one client in particular that I had been a pharmacist from graduation to, down the road, we're owning our own business and running that. She called me one day and she said, Janet, I've ate myself to death. I'm dying. And she was only 50 years old. And it really gripped me. It was hard for me to accept. She was like, thank you for everything you've done for me. I'm so grateful. And after I'm off the phone with her, I'm just in my brain fighting, and my heart is fighting, like, did I help dig that grave? Did I do the best for her? Did I really give her the tools to become a healthier individual? Obviously, patients need to take responsibility for their own health, but I don't think I ever once talked to her about diet and her diabetes. And I just filled another prescription. And so that was really heavy on my heart. So I said, Shawn, we have to do something different. If we don't, I just can't do this anymore, because it was just one more med after the other for our patients, and they were not healing. I mean, we were talking about healing for humanity in Seattle, and it was amazing to see people and how their lives had changed. And even your journey, I mean, we want people to thrive, not just exist. So that laid so heavy on us that we changed our model and really focus on wellness and helping people balance their hormones.
Have you found other pharmacists with similar feelings, leanings towards the healthcare industry?
That's a great question. And I will say this, Dr. Nelson, of all the bad stuff that came about through COVID, and of course you practiced during COVID, one of the things that happened is it woke a lot of people up. And I can say, I don't know if I knew any pharmacists before COVID that were kind of along the thinking that we were. We've been thinking this for 2 decades. But I will say, I can think of, I mean, off the top of my head, at least a half a dozen, and there's a lot more because there's groups out there of them now on on social media and stuff. So that are definitely thinking this way. And unfortunately, some of them were so disenfranchised. They just, as you know, with probably some doctors, they just left the profession totally. And then the sad thing about that is, whether you have a nurse or a doctor or a pharmacist that wakes up and sees the light in medicine, is like, wow, what we're doing is wrong. When they leave the profession, the problem is we don't have an advocate anymore. And the people that are left are the ones still promoting the system. So Janet and I didn't want to leave the system because we feel that we want to disrupt the system, and that's what we feel we're doing. So there is a lot. I think there's a lot more pharmacists out there now that realize that the whole scam of medicine that's going on with cholesterol and blood pressure medications and XYZ medications, diabetes medications, whatever.
And the thing is, I mean, it's something horrible that happened, right? That thing 5 years ago, but it was eye-opening for many people, like you said. Yet, going back, you said you've been doing this for 25, 30 years. I've been doing it for a little bit even longer than that. And I think we have changed. We have seen the change on the polypharmacy in particular. I mean, I never had a patient back in the 80s with 25 different prescription medications. Believe me, I have had it recently. Not me. I have done a lot of temporary work, and remember being in a place where patients had 25, 30 medications on the list, and I had to spend a lot of time really going over medications and weeding out what they didn't need, de-prescribing what really wasn't absolutely necessary, without having even time to discuss the problem for the visit, because I think that's very important. Recently, I was doing a research on supplements, and I went back 65 years, back to 1960, because that's the year I was born. And basically the same conclusion, even with supplements.
Yes.
Because over 65 years, we've been told every month, every year there's a new thing out there.
Yeah.
This new
Yeah.
vitamin, superfruits,
Yeah.
and they all are they have studies. Even if they have studies, if you try to take everything that you have lived through 65 years, I have a list already of everything I could have been taking in the past 65 years, and I would develop liver toxicity just by this bunch of supplements.
Yeah.
So the answer cannot be more medication and more medication. And basically, our health care or sick care is kind of based on that. So I'm glad there are people out there who will talk to their patients. And Janet mentioned patient needs to take responsibility. Oh yes, because unfortunately there are many patients that are enablers of the system. They go to the doctor
Yep.
and just give me the medication. Let me walk out of here. If you're diabetic, just give me the pill, the GLP, and let me go and eat whatever I want. Right?
Well, yeah, and basically what you're discussing, we had a podcast episode on it this morning. So our podcast is Health Solutions with Shawn and Janet Needham, and basically is what you're saying. There's all these new things out there, this new supplement, and we own a pharmacy and we sell supplements. I mean, and I think there's benefits of some of them. In fact, many of them, but you don't need 50 of them, and there's probably nothing new that we really need. I mean, vitamin D, omega-3s, things like that, those are important, and those you can get from food. There's no doubt about it. But the most recent trend is, and just like all the biohacks, Dr. Nelson, red light therapy, sauna therapy, cold plunge, or the new peptides, this peptide for that, and this peptide for that. And it's like, look, humans have thrived, like you say, for thousands. You didn't say thousands of years, but you said before the 60s, humans have thrived for many, many years without those supplements, without those things. So we can still do that. Why? How? We just eat really good food. That's all we got to do, and move and sleep.
Yeah. So I just picked 1960 because that's the year I was born. We can probably have the same results over the years, going back to the Wild West and snake oil. But I think we agree that the solution is not add this and add this and add this without changing the basic stuff, which you have already mentioned: lifestyle, sleep, metabolic disease, and reversing those things. So you mentioned you did have a personal story of healing. So tell us about it.
Yeah. So I've heard, I grew up eating horrible. And we are products of our environment. And I don't necessarily blame my parents. They didn't know any better. Okay. And
So
on my mom's
I'm
side,
sure they didn't intentionally feed you horrible things.
right. And on my mom's side of the family, there's 3 generations of obesity. And I got away with it for a while because I was a very active kid. So I didn't have any weight problems until after college, and that was partly just a monetary thing. I would have had a weight problem during college, except I didn't have the money to eat too much. Really was really the case. And I was still active, lifting weights and stuff. I wasn't doing a lot of intense exercise, but I was still lifting weights and stuff. And then after college, I just started struggling with my weight. And I went through yo-yos with diets, and I'd lose weight and then I'd gain it. I'd have some kind of event like a weightlifting competition that I had to make weight for. And I'm like, okay, I'm going to lose weight. And then I gain it back. And I went through that over and over again. And then in 2009, and of course, my kids are getting to be older. At the time, they would have been 9 and 7. I'm like, you know what? I don't want to be that parent that can't play with their kids when they're teenagers. I want my kids to be active. I want to be active with my kids, but I can't expect my kids to be active if I'm sitting on the couch, eating junk food, watching TV. So, in 2010, basically January 1st, I did all my blood work and stuff before, my weight and all that in December, so I'd kind of have a baseline. And then January 1st, I started a new life, and I lost about 60 pounds in about 5 or 6 months, and I, for the most part, have kept it off. Um, I've gained weight since then, on and off. I mean, I'm not as light as I was then, but I've put on a lot of muscle mass because I started training more intensely and doing more resistance training. So, and as you know, Dr. Nelson, the scale is just a piece of the puzzle. So, and I just, and I largely I lost that weight. I didn't lose that weight by exercising. I lost that weight by changing my diet. I was
Yeah.
on a high
And there,
protein.
there say it is a piece of the puzzle, definitely, but there say not the most important piece,
Nope.
because you can lose weight in many ways that are not healthy.
Yeah.
Right.
You end up suffering the consequences eventually. But
Yep.
yeah, you have to address the diet by itself first could help you lose weight, and whatever way of eating you're following, but you cannot out exercise a bad diet, right?
Not even maybe. I tried, Dr. Nelson, before I finally, the bingo light went on in 2010. I tried to exercise my way out of a bad diet, and it does not work. And Jan and I are both cyclists, so we ride our bikes a lot, especially when we're training heavy for an event or something. And still, I mean, I'll burn 5,000 calories in a day, but you can out eat 5,000 calories. You start eating junk food, and it goes fast, especially non-satiating processed foods, which are usually high in carbohydrates. They don't satisfy you. You can just keep eating them and eating them.
All right. We have a couple of questions and comments here. I highlighted some comments that they're not questions, all of them, but I think they're important to highlight. Cheryl is saying, my 35-year-old daughter is a pharmacist and was in long-term care, and now is in the hospice pharmacy. And by the way, one of the things that happens with hospice, I've dealt with many patients in hospices. I think the smart doctors usually will take them off everything. I mean, if they are in hospice, probably the right thing to do, and then just add only what's necessary. And the thing with many medications, including the statins, they may not really add that much to life expectancy, right?
No.
Anyway, she was disillusioned with the way healthcare system works, and still is.
That's Cheryl, that's not uncommon for pharmacists. We got out over 30 years ago, but I mean, even when I was an intern, I'm like, seriously, I can't believe it's this way. And it has only gotten worse. We were talking about polypharmacy, a little bit ago. I mean, when I was in pharmacy school, I mean, to be on 6 medications was a lot.
Yeah.
And now we'll hear people that, talk to other pharmacists that work at whatever retail pharmacy. And it's like, oh, no, I had a patient on 35 meds. This is common. It's like, I mean, just rationally thinking, Dr. Nelson, I don't care what those meds are. There is no way taking 35 meds is good for you. And they're not necessary. 35 meds.
I can probably guarantee you that they're having some adverse effect that is worse than whatever the conditions the patient has are. It's just incredible. I've seen it. So I have always been a little bit of a disruptor. So I have tried to avoid doing that.
Yeah.
Even before I was in this low carb keto carnivore world, it has never sit right with me to have so many people. And the thing is, I find that this is a criticism to my own, medical community. Very often, for example, treatment of diabetes, which is one of my things that I want to fight, you have duplication in many of the medications. So if you put them on a new medication that's kind of doing the same thing as the other one, then take him off the other freaking medication.
Oh, I know.
Right.
I know.
Right.
I see so often
Hmm.
patients, patient is, for example, not that it's the best thing, but let's say a patient ends up having to use insulin. Well, guess what? The sulfonylureas, glipizide, glimepiride are among the latest ones, and they're already 30 years old, 20 years old. What the only significant thing they do is squeeze more insulin out of the
Yeah, right.
pancreas. So why, if you're gonna put someone on insulin, take them off the sulfonylurea, because all you're doing now is causing hypoglycemia.
Yeah.
Yes.
They're gonna have episodes
You're right.
and worse outcomes than if you at least take him
Right.
off that medication. That's just one example.
Mhm.
Uh,
Yeah. It becomes
anyways,
management of side effects of drugs, which is ridiculous.
And let's just call it, one of our pharmacists that have seen the light, she taught me this. Let's just call side effects what they are. We were taught side effects to water it down, but what it really is toxicities.
Right.
Those are toxicities
it is.
from a drug.
Yeah,
They're poison.
is.
Drugs are poison.
Yeah, it's causing damage. Now, we have a movement now in the United States, and just, we're not going to get political, but of course, the president is always controversial, and RFK also is controversial. But I think their heart is in the right place, and they want to get people healthier. Actually, I was just watching this morning some of these hearings, and anyways, there's disbelief on both sides sometimes, and
Yeah. So let me comment on that, Eric. Thanks for the comment, Eric. That's good. I mean, RFK is, with the Maha movement, trying to speak health into our nation. I will tell you, I'm just a skeptic. The government is the one that ruined our healthcare system, just like I talked about in our book. The government is the one that ruined our food system. Think about the food pyramid. Okay. The only way that government can fix it is to get out. I mean, if you think about what RFK, one of his major accomplishments early on was getting rid of red food dye number 5. I mean, come on, people. I'm not saying red food dye number 5 is good, but what I will say is that's not the majority of the problem. Okay. And even seed oils that he talks about, I'm not saying seed oils are good. I just don't think that's the majority of the problem.
we cannot wait for the government to do something that is
Exactly.
a responsibility.
Exactly. We have to educate, as healthcare professionals, Dr. Nelson, we have to educate patients, educate and empower them to take charge of their own health, just like we have to do.
And as an example, Eric also comments about people that really don't have the government in their lives as much as they can avoid it, right? Yep. And you can argue with that. Just don't take any medications. Maybe the outcomes are better. Maybe I don't know.
Well, let me comment on that. I was doing and Cheryl's probably watching. Her daughter is was a pharmacist in long-term care. I did a long-term care rotation, and the instructor that I had, so I'm doing a workout. We had to find a patient and follow them, and I found so I started opening charts, and it's like there was this one gal, and she was like she was a centurion. She was 100, and I'm like, I asked my professor, I'm like, Well, I wanted to follow her, but she's on any medications. And the professor, I don't think we would be told this now in pharmacy school. The professor says, well, Shawn, you got to think, if she was on medication, she probably wouldn't live to be 100. And I'm like, and here I am, I'm like going to graduate in a month. And I'm like, wait a minute, I thought drugs made us healthier. And I mean, she sat there and told me the truth. I mean, and that is the truth. And Dr. Nelson, I don't care what studies they show me on blood pressure drugs, on cholesterol drugs, on diabetes drugs, especially blood pressure. If you have a hypertensive emergency, I think that's a problem, and you could, maybe stroke out instantly. Long term, though, over the years, I don't think blood pressure drugs, I don't think diabetes drugs, I don't think cholesterol drugs do anything to decrease mortality or decrease morbidity for sure. In fact, I would say they increase morbidity because they have so many toxicities.
Well, I don't remember the particular study, but and there are many that are, the conclusions are different. Let's put it that way, and sometimes that may have to do with the funding, but let's not get there. But I think there's a study on beta blockers where the beta blockers did not influence all-cause mortality.
Right.
They did have less incidence of strokes, which to me that translates in maybe increasing quality of life some, but they had an increase in heart attacks.
Mm-hmm.
So, at the end of the day,
right,
you put everything on a balance, and
if you saw a few years ago, Dr. Nelson, you probably know the study better than I do. I don't follow studies because I don't trust them anymore. So I hardly ever quote studies. But the same thing with aspirin. Remember, everybody that had a heart attack were supposed to go on a beta blocker and aspirin 20 years ago, 30 years ago. And now the studies have come out that aspirin does not increase the decrease in mortality of cardiac patients at all. And I mean, I think, and there are studies out there on the cholesterol drugs, but it just goes to show you, here's the thing. And here's my rational thought. I tell people, I'm not a smart guy. I'm not a scientist. I'm just a rational thinker. So you're telling me that, somebody can be 100+ pounds overweight and they take a statin to lower their cholesterol and it's going to decrease their mortality. I'm not buying it. I don't care what study you show me. There is just that doesn't make sense at all. I mean, your problem is not cholesterol. I mean, look in the mirror. You don't need any fancy blood tests or any fancy imaging. You're overweight. That's the problem. And, obesity is a real epidemic in this country. And, more people, the most dangerous thing as an American to do is to be overweight. More people die from obesity-related disease, diabetes, cardiovascular disease than any other thing that Americans die from. Car wrecks, gunshots, cancer. Obesity is the worst thing you can do as an American.
Yeah. Well, just to kind of speak to the Amish being brought up, I was raised on a farm and a ranch, so I drank raw milk. Raw milk was something that I didn't even drink from a carton until like my first experience as a kindergartner, and I refused. I'm like, this stinks. This is bad. This is not good. But the fact that we have gotten so far from our food sources to where we are, I mean, I honestly think that is part of the obesity problem, is because we don't bring good nutrients into our body. We're always starving for our nutrients. And yes, it's okay in our country to overeat. That's accepted, right? Like food's accepted, where maybe smoking's not, doing drugs recreationally is not, alcohol is, but we have this, food's okay. But we've lost what food should be. And I was always taught, if it needs to look right, if it doesn't, you don't consume it. If it doesn't smell right, you don't consume it, right? If it doesn't taste right, you don't consume it. And our palates have really changed since we've went back to eating healthier. Like I I can't tell you the last time that I even had a donut or even cared to. In fact, the smell of them are kind of, right? It changes you. Like when you start eating real food, your body starts changing. So, the Amish haven't left that. They live off what they make, and they work daily, and they're on a consistent life style. Like they probably go to bed at the same time, get up at the same time, do the same thing. Like their
Yeah.
lifestyle has created health for them.
Plus,
Unlike,
they have a sense of community,
Community. Oh, yeah.
like
yes,
many other people don't have,
Yeah.
and that is a common thing in the so-called blue zones. That's probably more important than the diet itself. The sense
I
of
agree.
community, the togetherness, because that decreases stress.
For
Mhm.
sure. For
You
sure.
know, anxiety, depression. We feel alone in a world where we're supposed to be connected now with all these devices, but people are really by themselves.
Yeah.
Very true. In fact, our youngest son is 23, and Jordan has been talking about how his generation has lost relationships with people, unlike maybe my mother's or Sean's dad. That connection has not maintained itself. And some of that is what we've kind of lived through, but we have to be more purposeful, I think, because we do need those connections to be a healthy individual. And like you said, the stress and the mental health and just purpose in our life, if we're not getting that as we age, we're going to fail to thrive. I mean, just like an infant, if you don't bond with your parents and your mother, you fail to thrive.
Yeah.
Eric has been very prolific in comments, but he's just 2 weeks, not 2 weeks, 2 days ago, one of my cousins sends a picture to, we have a cousins chat, and I have over 50 first cousins. And he sends a picture from 1957.
Uh-huh.
It's a youth group in a church. There are probably uh, 50 young people in the church where the picture was taken. Not one of them, I would say, was overweight. There was one that maybe in the context they would have considered her being a larger girl, but nowadays she would be on the skinnier side probably.
Right.
I
Right.
mean, not one,
Right.
not one, and there were over 50 people there. That's
Jen and I have talked,
1957.
right. Jen and I have talked about this over and over again. We talk about when we grew up, there was, there was one overweight person in school, out of 100 kids or whatever.
But today they would not be.
Today is well over 50%. And that overweight person in school, I mean, they were like, I think of the one guy that we called overweight, and he was probably close. He was taller than me, so he was probably 5'10", close to 6 foot, and he was 190. And he was considered overweight. I mean, that is
Well,
nothing now.
I was usually the overweight kid in the class, and I have a 11th grade group picture, and I have shown that to people, and they can't pick me out of the group. So yes, I was heavier than probably the rest of the kids. There might have been one or two more than me, but it is different nowadays. And like Dr. Kiltz like to say, obesity is not the cause of disease. Whatever else is happening that's causing the other metabolic problems is also causing the obesity. If you have any other questions, please put them in the chat.
One thing I want to go back to Eric's comment. Eric, you commented about $4 trillion on healthcare that we spend, and we're the wealthiest but the sickest people in the nation. I think that's part of the problem, Eric, is that, and I write about this in my book, over 85% of all healthcare expenses are paid for by government programs, either the federal government or state government, Medicare, Medicaid, VA. I mean, the list goes on. And the problem is, and Dr. Nelson, you can comment on this. in the healthcare system, people have no skin in the game. So they'll say, well, you know what? I don't care that I'm spending, that my insurance is paying, $2,000 a month for medications. So why should I, so why should I lose weight? If those people had to pay for those medications, even though they do, I mean, we all pay for it. If they had to pay directly, I mean, I think our system would change in a heartbeat. How many people won't start, well, I would, start eating healthy if my insurance paid for it. I'd go to the gym if my insurance paid for it. It's like, come on. I mean, that's ridiculous.
Yeah, that's not taking personal responsibility.
No.
That's expecting the government or the insurance company. And like you say, we eventually pay for it one way or the other.
Yeah.
However, when government tries to provide more health insurance, prices skyrocket. When government tries to, we've been covering for Medicare people medications only for the last 20, I think the early 2000s. Before that, you had to pay for it even if you had Medicare. So you think about it when you have to actually take the money out of your pocket, or in this case, nowadays, put your device to it. And it hurts more when you're paying the money right out of pocket. Now, we're still paying for it. That's what many people don't understand. And I remember an example that is not medication, but many years ago, I was doing prenatal care. I'm a family physician. I was trained in doing deliveries and prenatal care. I'm doing prenatal care in a lower income clinic. And it was really very early in the pregnancy, and she wanted to do an ultrasound. I'm literally talking 35 years ago. And she wanted to do an ultrasound. I said, well, it's not time. We do it at this amount of weeks. We had a routine. So it was going to be done, but it was too early for her to have it. No, but I want to have it now. I said, well, normally, but it's free. I said, wait a second. It might be free to you right now, but someone's paying for it. You have insurance? Yeah. Well, your insurance is paying for it. And everybody that pays taxes is covering that. So it's not free. And that cognitive dissonance, I guess, when now you have coverage, then you're more flexible about spending the money. And, that comment about the money we spend, prices have only gone sky high, and our health in general has gone the other direction.
Well, I write about that in my book. And Medicare Part D, where Medicare first started paying for drugs, was 2007. So you're right, in the early 2000s. And the year after they started paying for drugs, the price of drugs went up 19% in 1 year. I write about it in my book back in the 60s when Medicare first started back in 1964. Not only did prices increase, but utilization increases. So the utilization of nursing homes within a few years after Medicare passed in the 1960s increased 700%. I mean, nursing homes were basically created in the United States because of Medicare. I mean, nursing home was not a big business until Medicare started paying for it. And it wasn't necessarily Medicare and Medicaid. I get that. But they're both programs passed under the same government bill. So, not only when the government starts paying for healthcare do prices increase, but utilization goes up because, like you say, there's that person that says, well, it's free. I don't have to pay. I'm not paying anything. I'll just go do it.
Absolutely. Brian, before you were a teenager, I guess, my doctor quit medicine because of insurance mandates. That was the beginning of the failures. in this country. And unfortunately, we have many examples even outside healthcare, patient, no, college education, and universities. As prices started skyrocketing when student loans became
Yeah.
available, right?
Right.
And for some reason, these two areas, healthcare, education, the increase in the cost of those things is not parallel to inflation. You cannot blame inflation, which is,
No.
I guess, a natural, to certain degrees, a natural thing. It's outpaces inflation by, thousands of times.
And what do those two industries have in common? Education and healthcare both have in common is they are highly government subsidized, and that's what makes the cost skyrocket.
Yeah, yeah, certainly. Like I said, when loans became available, and anyways, don't want to get too much into the weeds of the politics. The bottom line is, whose responsibility is your health, Sean?
Right. It's up to the individual. And I, speaking of insurance, um, unfortunately, anytime we talk about healthcare, we have to talk about politics because it is a little bit political. But I agree with you. Ultimately, the responsibility lays on us. I write in my book, in chapter 6 of my book, which is the 6-step solution on how to fix healthcare. The first step solution is to empower people to be in charge of their own health. But the opening line I have in there is, the best health insurance we have is not some kind of policy that we can buy. It's right here. It's how we take care of ourselves. There is no better insurance than what we eat, how we sleep, and how we move. That is the best insurance we will ever have. I mean, Jan and I haven't went to the doctor for a long-term disease, for anything, and I don't know how long. I mean, and the last time our kids went to the doctors, one broke his wrist and one broke his leg. I mean, those are things we should go to the doctor for. We should not go to the doctor for diabetes. Diabetes is reversible, period.
Uh, just today or yesterday, I had like a 10-minute chat with Dr. Boss about reversing type 2 diabetes. It's in Dr. Kiltz uh, channels. Look for it. Very interesting. Uh, I'm showing your YouTube page, Moses Lake Professional Pharmacy, and I know you have links there to Linktree, and all the things are
Yep.
there. So go there, subscribe to the channel,
We are and,
and
and we are actually streaming live on um our Instagram right now, our Health Solutions with Shawn and Janet Needham Instagram. And we're on one of my Facebook pages. I don't know if we're on our podcast page or my personal Shawn Needham page, but we're streaming live with you guys right now.
by the way, if there are any questions in any of those that I don't see, shout it out, and
Yeah, they don't come up. I don't see them come up on my end when I stream with you, but I'm not an expert at this, so but I don't see any.
it's okay. Uh, so
I will go check mine.
you had problems before, which you have improved. So what way of eating are you doing right now? Are you buying a lot of stuff in boxes, bags, and cans?
So,
I'm being facetious, of course.
right. So, if it doesn't rot, we try not to eat it. So, the inside of the grocery store, we avoid at most costs. We probably go through a whole beef at least twice a year. We do have 2 boys that are men now that help raid the freezer, but
Yeah.
I'm as a mom, I'm
Have at it.
yeah, come and get it. Um, but we do incorporate some like berries, and Sean does that more than me. We do eat dairy. I'm not opposed to dairy. We do eat some vegetables, but our core diet is probably more protein. Um, and
Animal protein.
and I probably more than my husband, love red meat, but I do eat chicken and fish
I like
and some
I
pork.
love red
But
meat.
right, but we do have other foods like carbs in it. We don't buy bread. Not that I don't like bread, but we just don't. We just leave it at the store. And our motto is if it's not rotting, we probably shouldn't be eating it. And quite honestly, I don't really miss a lot of foods that we used to eat. I mean, the box of cereal that you could sit down and eat the whole thing never really filled you up anyway. So, that's not in our pantry. In fact, our pantry's kind of odd.
It's kind of our pantry's kind of bland. I mean,
Yeah.
and
I
yeah,
believe,
I mean,
I believe you.
and our freezer is full of meat. Our fridge is kind of bland too because we'll put some things in
Yeah.
there. And
So far.
I like pork. Janet doesn't like pork. I mean,
Not
she
as
likes
much.
bacon and sausage, but
Oh,
I
yeah.
like pork. And one thing is one thing we'll tell patients like that have diabetes or any kind of disease when they say, "Well, you guys don't eat carnivore." It's like, no, we don't eat carnivore because we're not sick anymore. But if I was sick, I would go pure carnivore. I would go probably red meat only for like 90 days at least. And that's what we tell our patients to do. Anytime they have whatever disease, it's like, you know what? We refer them. I love Rivero.com. I don't know if I can plug them or not. I hope I can.
Yeah, no, go ahead. We promote anyone in the space.
Okay.
So
So I love Rivero.com because unlike a lot of these influencers that we were kind of referencing earlier, but we didn't say any names, they don't sell supplements, they don't sell peptides, they don't sell anything besides diet, and they focus on carnivore. Yeah, I get it. Somebody could argue it's like, well, that's how they make money is selling carnivore. Well, yeah, because it helps people. But once you get to be more metabolically healthy, you can eat fruits, or we eat very little fruit, but you can eat berries. I guess berries might be a fruit. Berries, vegetables, dairy, and we eat potatoes. But we're metabolically healthy. I would tell people to stay away from that if they're sick.
Right. And I usually say to women too, especially, when we're in our space of helping women with their hormones and being healthy, the biggest thing that we have done to ourselves is eat too many salads and not enough protein. So eat your protein before you do anything else. So I try to do that. And as you notice, I'm a fair individual. My skin has changed tremendously. I mean, I used to be the one that was like hiding underneath, slathering on the sunscreen and I don't. I don't have to. I mean, it's amazing when you have the nutrients. Of course, I'm careful and I expose myself slower, but my ability to be out in the sun has lengthened tremendously. I wish I knew that when I was a young girl, right? I wish I would have had that, but it's made a big difference just in my ability to be outside, which to me is just, bingo, you are what you eat, right? And your skin reflects that on a, we've seen amazing results even just in maintaining muscle mass. I'm into menopause. I've been able to maintain my muscle mass, and that's going to give me longevity as well as being able to be healthy and thrive as I age. So it's made a big difference, I think, for me. I mean, obviously, when we cycle long distance, we do have to supplement that a little bit, but the core of our diet is making sure that you get healthy protein. And I'm not a protein shake drinker. I've never been. I don't run with that. I know a lot of people do, but I just think there's too much sugar in them.
Well, and I mean, Jan and I say this, and I mean, some of the haters will not like this, but you have these influencers that talk about maximizing your protein, and we do. And Janet says protein; she really means meat.
Fatty meat is the answer. Fatty meat.
Yeah, right. And eating a protein bar or drinking a protein shake, that's junk food. I'm just saying it. I mean, and you shouldn't drink your calories. I mean, made to eat your calories. Dr. Nelson, I see a really interesting comment I'd love to answer. Alina, as a pharmacist, can you put that up on the screen? I'm loving these comments, by the way. Keep them coming.
Eleni,
as a pharmacist who is carnivore, it's getting harder and harder for me to practice in retail and have a clear conscience. Pretty much everyone can be helped with diet change. Eleni, I'm thank goodness you've seen the light, and I sympathize and empathize with you, and I will tell you this, as you probably know, and I'm not trying to sway you one way or the other. I think it's very, very difficult to practice pharmacy or practice medicine in a traditional sense because I think it is unethical. I think it is unethical what we do as pharmacists and what we do in medicine to most people. We give them blood pressure meds, we give them diabetes meds for diseases that are lifestyle caused. I mean, I will say this, Alina, this is what I say, and I'm not picking on pharmacists individually. Most pharmacists, and this is why we say we're different, most pharmacists are copay collectors for insurance companies and dispensers of poisons for big pharma. I do not want to do that. And I will say this, Jan and I are in a great place in our life. And there is not a dollar sign that would make me go back and work one day in those retail environments. I could not look myself in the mirror afterwards, and I'd probably die of a stroke from distress in those places. So thank you for what you do, Alina. And I'm glad you're seeing the light. And hopefully one day, maybe we can connect with us and we can communicate with you.
By the way, I'm going to say a couple of things I know about her that she hasn't posted here, but is not a secret. She and her husband are both pharmacists, just like you are. And her husband has a compounding pharmacy.
Oh, good for them.
Okay. Well, have them reach out to us. Oh, and Anthony says not all protein shakes contain whey and sugar. Can you post that one, Dr. Nelson? And you know, that's a great point. Although whey is just a byproduct of the dairy industry. I don't think whey is a bad thing necessarily. And sure, sugar, added sugar. Here's the thing I want to say about protein shakes. Remember, Janet already said, if it doesn't rot, don't eat it. Okay. If it's these premier protein shakes or whatever you buy out of the fridge, I honestly don't think that it's much better than eating a Snickers bar. I get it. There's going to be less sugar possibly and maybe higher protein. It's still junk food. If it's in a package, either packaged food is junk food or it's not. We talked about eating out of a package. If that protein shake comes in a package and or a protein bar, it's junk food. I don't care what ingredients it is. I'm not saying, you know what, and I eat them in a pinch when we're traveling. But
so
it's not real food.
Right. So the difference, I think, and maybe Dr. Nelson might want to chime in on this, is that when you are starting to drink something, the digestive tract is starting to stimulate in the mouth. So that's why processed things are not as good as whole food, in my opinion, because you don't assimilate your nutrients the same way when the process starts in your mouth. So I think that
you're absorbing them too quickly.
Correct.
Basically, the process has damaged them to be able to put them in that container.
And then, you know, I'll talk to patients regularly when they're having problems losing weight, and I'll ask, well, what are you eating? They say, oh, I eat healthy. I start out with a protein shake in the morning. I make my own. And then they tell me they put.
How about a couple of eggs?
Right, exactly. Eat a couple eggs and then you'll be full. But then they'll say, well, I put a scoop of whey protein in it, and I put an apple in it, and I put a banana in it. And, you know, it's all real, and kale and you know, and then I put some yogurt in it. It's all healthy stuff. Yeah. And you've just packed 700 calories into 10 ounces, and you drink that and you won't be full. But if you ate 3 eggs, that's going to be 210 calories. I can't eat 3 eggs when I'm eating it with sausage. It's hard to eat 3 eggs, seriously, because it's satiating. You know, there's nutrients there that your body says that was great.
Yeah, if I'm going to have, I don't have eggs every day, but if I'm going to have eggs, I might do something between 4 and 6. Yeah. And I could go 12 hours feeling full with just that.
Yes.
Right? Eggs are so satiating.
Yes.
And they're much cheaper than protein drinks. I'm just saying.
So Eleni says that, yeah, she's definitely trying to get out of it. She does work. She does work in retail. We won't mention the place, but
Alina, we can put you in touch with a couple pharmacists that have done that. I mean, we've done it, but there's other people that have done that. I know of somebody just recently. She over the last year got out of retail. She does personal health coaching, and it's a lot more rewarding. Let me put it that way. That's one thing that we love what we do, Dr. Nelson. Our patients get better every day. We have patients say, "You saved my life. You saved my marriage," and we're like, "Seriously?" And when we were in the dispense and poison realm in retail pharmacy, not once did a patient say, "Thank you for giving that blood pressure med. Thank you for giving that medication for diabetes or that cholesterol med." Not once did we hear that, ever.
all righty. So you have your Linktree link on your page, and I'm sure that you have a link there to your book, right?
Yep.
What's the name of the book again?
Sickened: How the Government Ruined Healthcare and How to Fix It.
All right.
And all these links, if they go to our pharmacy page, mlrx.com, and if they can find it on our YouTube page, if you go to mlrx.com, all those links are there. But you can just Google us. We'll come up.
Yeah, and it's on Amazon as well.
There we go.
You do have all the links there on your YouTube
that's
page.
right.
So
yeah, thank you.
go subscribe, and you have a link tree. You have the specific link to the book, your Facebook, your Instagram, your X. Ever get into a little bit of arguing in X?
No. X has been good to us.
Okay.
The only one, YouTube's the one that we've had some issues with.
Yeah, TikTok too.
Oh yeah, TikTok. TikTok doesn't like us sometimes.
And we also, I'm very passionate about helping women with healthcare and through all stages of life. I think that's one thing that if I could have, and my generation could have avoided the synthetic hormones and the birth control pill, that in itself. But we do have a series on women's health, and great information there for people to sift through. We love to do that and help people and just teach them, give them the tools to how to navigate, because I think sometimes women aren't really told, especially even as young teens, what's normal for your body to go through these changes, what's not normal. I see so many women that my age have been put on antidepressants and antipsychotics, and it really could have been fixed with diet, exercise, sleep, and balance their hormones. And, rather than being on big pharma, like Shawn says, the poisons. And, we take at face value so much when we go to a doctor, because we never questioned what they told us. And now we are at this point where we're like, maybe I should get another opinion. Maybe I should think about whether this therapy is really good for me or not, because I heard all through school, most of my life, safe and effective, safe and effective. It was effective, but it may not have been safe.
And what Janet's basically saying is that we love to get in front of people. She loves to get in front of a women. So if anybody out there can get her in front of, a group of half dozen or more women, she would love to sit there and talk to them. We love to do in person. We could do virtual too, but we like in person the best because it's just more intimate. And we just love to get in front of people and talk about our journey. We think it's very powerful that here are two pharmacists that don't believe in drugs to treat long-term disease. So if there's anybody out there that wants us to be on their podcast, or anybody that we should connect with, please reach out to us and we will reach out to them and we will try to get on their podcast, because we love sharing our journey. It's very powerful. We honestly think that we were put in this position for a reason.
Now, I can tell you that my life has been saved more than once by antibiotics, for example.
Absolutely.
Yep.
I used to get a lot of allergies. I don't anymore. I used to get sinus infection 2-3 times a year. Don't anymore. But this is how everything starts, with a runny nose, which is purely allergic. It would turn into a sinus infection. Then it would go down to my throat, and down to my lungs, usually bronchitis, but this particular one occasion, I developed pneumonia. So here I am treating myself, by the way,
Oh, wow.
with my first line antibiotic, took it, second line, took it, not better, third line. So, of course, what do? I go and have my x ray and do go and see a lung doctor because at this point I'm having almost 104 temperature, coughing up, wheezing. I
Mhm.
knew I had pneumonia, and then the x ray confirmed it. And she put me on yet a fourth antibiotic, which I normally wouldn't use as a first line because it was levofloxacin.
Uh-huh.
And
Mhm.
it's a pretty good but very strong possible side effects
Yep.
antibiotic. Well, I'll tell you what, Levaquin, which is the brand name, levofloxacin, has twice saved my life because
Sure.
treated a pneumonia that otherwise would have, you know, we go back 150 years, even 100 years, I would have died probably from the
Yeah.
pneumonia. So it's not that medications don't have its place.
Absolutely. Yep. And we talk about that regularly. Um, another one is opioids. You know what? I mean, I've broke my wrist before, and I'm glad I had opioids, and I've broken other bones. Now, I don't want to rely on those long term, but you know, thank goodness we have pain meds. Thank goodness we have
Yeah.
anesthesia. So when we can have surgery, thank goodness, Dr. Nelson, we have epinephrine. So if somebody has a cardiac issue, we can give epinephrine. I mean, we mostly don't believe in drugs long term for chronic disease, especially when it's related to your diet. That's
Yeah.
what we don't believe in. And as pharmacists, we understand that acute medications, they are life saving. I do have to ask a question, Dr. Nelson. So when you had pneumonia, were you overweight then?
I was this guy.
Okay. Do you think, and I'm asking to be a serious conversation. Do you think if you had less weight, carrying around less weight, and you were more metabolically healthy, your immune system would have been healthier? Do you think your life would have been in as much danger if um, without the antibiotics?
So I'm going to tell you that with a statement about the 5 years ago little thing we went through. Almost everyone who died during the pandemic was not metabolically healthy. That was a
Right.
key thing. It didn't
Yep.
matter if you were 80 years old, 50 years old, 20 years old, a bunch
I
of
agree.
all ages died. Most of the deaths were because they were not metabolically healthy. And here, see, I think the weight is a reflection of the metabolic dysfunction. Many that I had. I had a stroke 7 years ago. As a matter of fact, that picture is from just a few months after my stroke. And if we want to talk about markers, my blood pressure was high, my diabetes was on control, my triglycerides were very high, my HDL was very low, and you can see around my waist it was pretty big. And so yes, I was definitely the metabolic mess, and I paid for it
Yeah.
with having a stroke, which right now I still have some minor issues from the stroke, but definitely in much better health
Go.
once I made the change.
Yeah. I just had to ask that question because I think, you know, kind of Janet has to step out. She's got an appointment, but we can keep going, Dr. Nelson. Um, during the pandemic, Janet and I were celebrating my 50th birthday, and we were in a limo with a group of like 7 people or so, including my twin brother, and we were all in a group chat. And we got back later on, and the group chat was still going, and they said, "Hey, did you guys test positive for COVID? We got COVID, blah blah blah." One of the gals just happened to be a new nurse that was just drinking the COVID Kool-Aid, and we didn't want to debate with her at all. So, but I refused to get tested. Janet refused to get tested. We never tested during COVID just because it wasn't going to change our treatment. And then later on, we realized it's like, oh yeah, I can't smell anymore. I can't taste. I couldn't taste. So we're pretty sure we got COVID. It was never verified by a test, but we never really got sick because we're metabolically healthy.
It's funny because during the pandemic, I didn't get sick once. It was only after the pandemic was officially over that I had my first encounter with that thing. And I've had it 3 times, I think. A couple of those times, it was my grandson who gave it to me.
Yeah, right.
But all those 3 times only lasted 3 days, and I was already here. So
Yeah, right.
did not have any major issues or
Yep.
anything like that. Unfortunately, I was forced to do the thing.
I get it.
But
So Beverly DeVille, you can make an awesome protein drink with 3 scrambled eggs and butter, 1 tablespoon of gelatin powder, 1 tablespoon of collagen powder, and water with whatever sweetener or flavor you want. Absolutely, that is true. I think, Beverly, it's much easier to drink 3 eggs and maybe even more than it is to chew them and actually enjoy chewing them and get the process of what's that called, doctor? What's chewing called in medicine? Cessation?
mastication.
Mastication. Yeah. Mastication. I think that's an important process for digesting rather than just drinking your calories. But yes, that is a healthy protein shake. There's no doubt about it. But I think it'd be this is what I ask you to do. Eat those things individually, and you probably wouldn't do it. So think about that. It's much easier to drink your calories.
By the way, you mentioned you only eat things that rot, but you do eat very likely 2 things that don't rot, because animal fat doesn't rot. So fatty meat, butter, you can leave it outside. I've only gotten ever, I remember years ago, I may have gotten some mold on butter, but it was because the dish was wet.
Yeah. And the reason the mold, I'm just guessing using my chemistry background, salted butter is basically preserved, and it's not a bad preservative. I wonder if unsalted butter, if bacteria and mold would grow on it. I'm guessing yes, but I don't know.
Probably. I haven't tested that theory because I don't buy salted butter, and I leave it outside. But every stick doesn't last even a week out. So we don't give it. We consume it a lot.
Yeah, going to my microbiology, I'm thinking about this. You mentioned animal fat.
Beef tallow.
Yeah,
lard.
And we have bacon grease. We use bacon grease to cook it. We cook in bacon grease and butter. And yeah, you're right. It lasts forever. And here's one of the things is that bacteria and mold, or basically all microorganisms, what do they need? They need water. They need water to live. And if fat doesn't have water in it, so they can't live on fat. That's probably, I'm thinking about that. So maybe unsalted butter would still not.
Anyways, Shawn, thank you very much. Thank you, Janet, as well. This is the book, Sickened, but the link was on his webpage. So not webpage, I'm sorry. The link to the webpage is on his YouTube. So go to the YouTube channel and you can see all his links and the pharmacy. Do you have clients all over the country as far as the pharmacy is concerned and the compounding?
Yeah, we're licensed in multiple states across the nation. A majority of our business is shipped, And our goal is, even if we're not licensed in that state, or we can't do business in that state because we're not licensed, we just like spreading good information. So we like getting in front of people and just talking about health and wellness, and we can throw hormones in there. We think that Jan and I, we really know hormones. We are 2 hormone experts. We think that there's probably no pharmacy in the nation that has 2 more versed people on hormones than our pharmacy does. And we're pretty proud of that fact. And it's because it's what we do. We talk hormones all day long.
All right. Thank you for being here. Thank you, everybody, for being here. Tomorrow morning, 6 a.m. Eastern Time, we'll be again on the morning live. And until next week, eat meat.
That's right. Thank you, Dr. Nelson, for having us on.